Health officials are preparing to roll out COVID-19 booster shots in the U.S. this September. According to a plan announced Wednesday, all U.S. adults who received a 2-dose vaccine would be eligible for an additional jab of the Pfizer or Moderna vaccine 8 months from when they got their second one. These booster shots are free, President Biden said in remarks Wednesday afternoon, encouraging people in the U.S. to get the shots when it's their turn. It will be easy. Just show your vaccination card, get a booster. It will make you safer and for longer. And it will help us end the pandemic faster. The timing of the move comes as something of a surprise. It was just a few days ago that the FDA and CDC recommended a third shot of the Pfizer or Moderna vaccine for a more limited population, people who are moderately to severely immunocompromised. The agencies made no mention then of imminently expanding this recommendation to the wider population. The new plan is contingent on a data review and subsequent endorsement by both the Food and Drug Administration and an advisory committee of the Centers for Disease Control and Prevention. This week's announcement raises numerous questions about how urgently Americans need boosters, how the rollout will go and more. Here's what we've learned so far. Federal health officials are seeing a trend. The data consistently demonstrate a reduction of vaccine effectiveness against infection over time, said CDC Director Dr. Rochelle Walensky at Wednesday's White House briefing. The evidence presented at the briefing consists of several recent studies from health systems that have been collecting data on breakthrough infections. These include the New York State Health Department, the Mayo Clinic, and the CDC's reporting system for nursing homes in the U.S., and Israel's Ministry of Health abroad. We know that even highly effective vaccines become less effective over time, U.S. Surgeon General Vivek Murthy said at the briefing. It is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now. Importantly, the studies do not show any major increases in severe COVID-19 disease, hospitalization or death among fully vaccinated people. However, Walensky noted that data from Israel suggest increased risk of severe disease amongst those vaccinated early. Dr. Anthony Fauci, Biden's chief medical advisor, also presented recent evidence showing that a third shot of either mRNA vaccine greatly increased antibodies against the virus that causes COVID-19. No, anyone who is fully vaccinated is still very well protected from getting seriously ill from COVID-19. Health officials were emphatic on this point. For now, anyone who has completed the 2-dose mRNA vaccine course is considered fully vaccinated, with a high degree of protection against the worst outcomes of COVID-19, Murthy said.